So hypoglycemia, usually we see it with diabetes, I will say. So it is just a low blood sugar. And I will say some people have relative hypoglycemia, which means, their blood sugar may not actually be low, but they feel like their blood sugar is low. And that's also a very uncomfortable feeling. And sometimes that comes from having really high blood sugars for a while. And so if you've got diabetes, kind of range blood sugars, and we get your blood sugars under better control, sometimes people feel poorly at the beginning, but that's not unexpected and it gets better. And we worry probably less about that. It doesn't feel good, but we worry less about it. I guess true hypoglycemia is when your blood sugar is technically less than 70. Now, for younger women, that's not necessarily uncommon, and that can happen kind of on its own. But, when it becomes less than that, for sure, so less than the 60s, people really feel uncomfortable. So probably the most common complaint is just kind of like a mentally foggy, feeling kind of jittery or shaky, having sweating kind of spells. And people feel really bad. They kind of describe the sensation that they feel like they're going to die. And so their first instinct is to get something sugary to bring that blood sugar up. It depends what the cause of it is. So probably the most common cause is just diabetes overtreatment, or treating, but if you are unexpectedly exercising and take your usual medicine, sometimes that can cause a problem. So probably the first best thing is just making sure that the medications that you're on are not playing a part into it. And that's the most common thing.